Our next speaker is Courtney Cox Wakefield. She is the Director of Digital Strategy at Children's Health. Her mission is to cultivate space in which families can experience empathy and empowerment. She drew that experience as a parent, where she spent nearly 100 days in the NICU with their daughter to work every day. Courtney's team looks after the user experience of children's.com, as well as search engine optimization and paid search. She's a frequent speaker at digital marketing events, serves at the editorial board of the Journal of Digital and Social Media Strategy, and more importantly, she's the co-author of a book that I wrote with her. So Courtney, thank you for being here. And please share with us your thoughts on your experience in the healthcare with COVID and how you guys have been shifting. And again, the floor is yours. Thank you for being here.
Thanks for that intro, Amin. And thanks, Jessica, for the intro that you shared. A lot of those numbers are really important and obviously shifting all the time as people kind of learn what the new normal looks like. So it's interesting to see everything kind of all in one place. I want to skip the obvious impact on healthcare. If you guys have been paying attention at all, you kind of know what that is, and you're not here to hear that piece. But I do want to talk about some things that are a little bit counterintuitive in terms of the way that the healthcare business and healthcare marketing in particular have been impacted. Right now, we're so hyper reliant on the industry for really emergent care related to COVID-19, but also related to other conditions and things like that that are also respiratory conditions and things that are reliant on PPE and the ventilators that are in short supply right now. So we're hyper reliant on our industry, and usually in periods where we're hyper reliant on an industry, that brings growth. But the problem is that as we have had to do so much of this social distancing, we've canceled as an industry millions of appointments that are not urgent or emergent. Our system itself, just as an independent individual system, has canceled tens of thousands of appointments that were not urgent or emergent. And that includes even things like surgeries. So it's a little, again, counterintuitive. My daughter had a surgery where she had to have a small procedure done, but it was going to, if it wasn't done, result in some issues for her down the line, some really serious issues. And so she had to have this small surgery done. That, in this case, in today's world, would be considered a non-emergent or non-essential procedure, even though it was going to lead to issues down the line. So that's a little bit counterintuitive. We've had to make a lot of these cancellations. And even in cases where procedures or conditions are emergent, are urgent, do need to be taken care of immediately, people are avoiding coming to hospitals. They're avoiding even going to their doctor. I saw one statistic, I can't remember exactly what the numbers were, but there's all these hospitals in New York that normally see lots of people coming in for heart conditions, heart attacks. They see them coming in for heart attacks. People are, they've seen a dramatic decrease in the number of heart attacks that they see. Why? Is it because people are having less heart attacks? Well, no, of course not. It's because people are choosing to deal with their heart attack at home. And that's obviously a problem for public health, but it's also a problem for hospitals who are reliant on the income from insurance companies and from people paying for that care. So what we're seeing across the board in the healthcare industry, despite our hyper reliance on them in this moment, is pay cuts and furloughs. Talking about children's hospitals in particular, all kinds of news is coming out, right? Texas Children's slashed their executive pay by 20%. Stanford Health has furloughed or cut the pay of 14,000 workers. Akron Children's is cutting their budgets by $40 million. There's just, headline after headline after headline of these major cuts that are happening in the healthcare industry. Really grateful that Children's Health is not on a hiring freeze, or we haven't cut anything at this point, but we are being asked to be extremely conservative with our spending and with our hiring, and that's obviously been a change for us. So in an industry that before all of this was otherwise growing and thriving, and that we're now very reliant on as a community, we're still seeing really hard times, like many of the other industries that you hear from today. And we're a nonprofit system, which is in this moment really helpful, but for-profit systems are struggling even more. They have tons of pressure to increase shareholder value. And right now, they're really struggling to do that. They're really struggling to make those year-on-year growth numbers that they set at the beginning of this year. And as a nonprofit, we're sort of immune from that because our main incentive is to make sure that we're existent for years and years and years, not to grow profits year over year. So that's been a real benefit for us. But if you are working at a for-profit healthcare system, or if you have clients that are for-profit, you really need to think about how that's impacting them, the fact that they have to answer to shareholders. So that's kind of like the financial impact or the baseline that we're dealing with here. It's the water we're all swimming around in. And in the midst of that, consumers are coming to us for information, support, and guidance more than they ever have before. The initial shift that we had to make was we had been focusing really hard on marketing, really trying to grow our system, really trying to grow and improve our consumer experience. And all of a sudden with COVID-19, there's been this major shift in the industry overall, away from marketing, away from consumer experience efforts, and toward communications. And for a lot of us in the digital space, we may have dealt with like internal communications and external communications and public relations on the periphery, but it definitely wasn't what we were doing on the day-to-day. And now most of my time is spent thinking about internal and external communications and public relations and educating the public versus doing marketing. So that was an initial big shift for us. We put a lot of projects on hold so that we could focus on communications. And in addition to that, in addition to the need to do all of this communication, when the demand was really high for that information from our consumers and speed was really necessary, there's also this risk for misinformation. A lot of other industries are dealing with this too, but healthcare has been particularly impacted by it. And so as we were publishing new information, every single thing we published had to be reviewed by a group internally that we call the command center. If you work in healthcare, you'll know what that means. But basically, it's a group of people who meet every single day, and they're together basically all day long, who are helping make decisions and move things forward and approve things. And that really slowed down a process that otherwise could have been really fast. And so I know a lot of our agency partners were trying to help us get through this period where so much communication was necessary. And they were experiencing, I think, some frustration about the fact that we had to get everything approved through the command center. So it was slowing things down. So if you have healthcare clients, definitely try to see what you can do to be patient and to help your clients get through the process of approvals during a time when risk is really high. There's also in healthcare a longer consideration period for most businesses than most businesses have. So you think about like retail or even things like restaurants, food services. People make decisions pretty quickly, right? Yeah, okay, we need to eat dinner. Let's get in the car. Let's go to Tribal All Day Cafe, or let's go to this other place. Okay, I need a new bread maker. Let me go on Amazon and do some research and buy that thing. For those groups to turn off advertising temporarily while they're figuring out, okay, how are things going to go, and then turn it back on, it makes a lot of sense to do that, because during a time when people aren't actively buying in the moment, it makes sense to turn off advertising or to turn spend way down. With industries like healthcare and some others, I know the travel industry is a similar way. People make much longer buying decisions. So if you're going to have a surgery, especially if it's an elective surgery, you're going to spend a lot of time researching. You're going to probably get a second opinion. You're probably going to talk to multiple doctors. And that means that from the time that someone initially kind of does a search about a particular procedure or condition or a specialist, it may be weeks, months, even up to a year, sometimes greater than a year, before they actually get that procedure done, before they actually have that first appointment or have that surgery. And because of that, when I'm thinking about turning off my marketing, I have to think about, okay, um, I'm if I needed to respond to the demand today, I needed to turn off my advertising 6 months or a year ago. Well, I can't go back and do that. I already spent that money. And so I have to think about, okay, how do I spend my dollars that I have right now most efficiently today so that I can save the money I need to save now to make sure that we can survive this moment, and also make sure that I'm still getting the flow of leads and email addresses and all the things that I need to make sure that my marketing 6 months and a year from now pays off when we're reopened, when we've got people coming in the door, when hopefully we are back at work or back to our new normal at least. And so we've really got to be thinking about that as the healthcare industry and the travel industry and some of these other groups that have really long buying cycles. So if you have healthcare clients, especially healthcare clients where it's elective surgeries that are happening and things like that, I'd really encourage you to have that conversation about, okay, if we turn off advertising today, what's the impact of that when we come back to work? Because you don't want to try to solve the problem today and cause long-term issues for their pipeline. We're also seeing things where, okay, that answering that question about how can I be more efficient? We're seeing maybe a shift away from TVC and toward digital channels that can be changed rapidly. So you think about, okay, if I buy a TV ad and I put an advertisement out there and it's ready to go into market, and today something happens where I need to make a shift. We have to close a location, or we're opening maybe COVID testing or something like that. And I've got this advertisement that's totally missing the mark. Well, I can't create a commercial in a day. I can't even really edit B-roll and turn it around in a day, but I can change paid search advertising, right? So you're seeing some systems shift away from those hard to change mediums toward things like digital channels change really rapidly. I think that's really good news for digital folks in our industry. And we're also seeing things where, it's, if you've got a lot of awareness-based advertising in market right now, you're probably shifting away from that, thinking more about demand-based advertising. It makes a lot more sense to spend money on somebody who's searching and saying, I need this surgery, than somebody who is just sitting on their couch and maybe doesn't need that surgery at all and is getting an awareness campaign from you. Definitely that awareness is really helpful for down the line, but when you have to cut, it makes more sense to spend it in demand versus awareness. And so we've been making some shifts that way. And also I've seen the industry as a whole making some of those changes. And then, like all industries, we're thinking a lot about tone, right? A lot of our advertisements that had been in market, and even photos and images that we had on our homepage of children's.com, they were very celebratory images and very celebratory videos. And right now, that just doesn't feel like the moment we're in. We maybe want to celebrate healthcare workers and things like that, but there's a right tone that you can hit with that. And we just weren't being somber enough. It wasn't as respectful as we wanted to be to the moment. And so we have swapped out some advertising on TV, and we're right now on children's.com, we have a provider who's dancing with a patient. They're dancing in the hallway. Beautiful image, tested really well. We love it. It served us well for a long time, but right now it's too celebratory. So we're moving to a different, equally beautiful image, communicates some of the same things, but has a bit of a more somber tone than the one that we've had previously. So thinking about those things too, and then also really trying to keep things going through all of this. We had projects like online scheduling and chatbots that they have positive implications for what we've got going with everybody shifting to being at home and shifting towards digital, and we don't want to stop that. In terms of the really long-term impacts that this is going to have, I think we're never going to go back to a world where virtual health is not huge. And so we have to think about, okay, now it's possible. Now patients know that they want to do this and that it's possible. We got to figure out as an industry, how do we get reimbursements for that? How do we advertise for it? How do we make it work? And then also, I think, as I mentioned before, we're seeing much more investment in digital, and I don't think that's going to end as well. One thing that is happening across advertising overall too is the acceptance of low fidelity video. Here we are, we're having this, I'm shooting this with my webcam. People are getting more used to this low fidelity, and I don't think that's going to change either. I think it's going to be a big benefit to our customers and to our industry overall. I think I'm out of time, so thank you guys very much, and I'll kick it back over to Amin.
Thank you so much, Courtney. Really appreciate all of your insight. And I do have a question for you. So one of the questions that we have is, how has your team adapted internally with the shift from, being the digital marketers in the room into being, the PR arm of a big institution, which is Children's? How did you guys adapt?
Well, luckily we have a lot of partners internally who are focused on comms, who are very smart and that we have built relationships with over time. So we really leaned on them for messaging. And then we said, okay, great. Now that you've given us that message, let us blow this out into a bunch of recommendations about how we can spread this message far and wide through all of our different channels. And we brought those things back to them and said, hey, this is kind of what we want to do. Of course, that had to route through the command center, as I mentioned before. But because we had already built that strong connection between our two groups, that really helped. So if you have those resources, whether they're agencies or internal, and you haven't built that connection yet, you need to go build that connection, because it's healthcare today that is experiencing that need, but it could be your industry later. So you definitely want to try to build those internal relationships, or those relationships with agencies that maybe are not digital, but in a crisis like this, they're really important connections to have.
Awesome. Thank you so much, Courtney.